Hello everyone, this is Dr. Jaykiran from the Department of Respiratory Medicine. Today I am going to share about few points about asthma. Today is World Asthma Day. World Asthma Day is celebrated every first Tuesday of month May, initiated by Global Initiative for Asthma in collaboration with WHO to create public awareness about asthma. Theme for the year 2023 is Asthma Care for All, means to promote the development and implementation of effective asthma management guidelines all over the world. Asthma is a chronic inflammatory disease characterized by narrowing of small airways with symptoms of shortness of breath, cough and chest tightness that may vary over time and intensity. Triggers like exposure to household dust, allergens, irritants or any change in weather or any acute viral respiratory infections or exercise may induce asthma. In India, about 34 million people are asthmatic. It accounts for 13% of overall global burden. It is estimated that 13 out of 1,000 deaths are related to asthma in India. Most of the deaths occurring related to asthma occurs in lower and middle income countries because there is under treatment and under diagnosis. Asthma is clinically diagnosed based on clinical history and functionally by spirometry and other tests like skin prick test, bronchial provocation test and FeNO aids the diagnosis. Once the diagnosis is confirmed, treatment is initiated by GINA guidelines. There is controller and relievers. Controller is by inhaled corticosteroids and reliever is by bronchodilators. The main goal of the treatment is to control the asthma symptoms and to prevent the future exacerbations. The treatment is given in the form of DPI, that is dry powdered inhalers, and MDI, meter dose inhalers. Advantages of inhaler over systemic drugs. It has rapid action. It directly acts on respiratory tract rather than involving other systems. The dosage used in the inhaler is micrograms rather than milligrams in systemic drugs, so that there is very less chance of adverse effects or side effects. Inhaler technique is the mainstay of treatment in the asthma. About 70 to 80% of the asthmatics don't know how to use inhaler technique properly. We come across commonly the people using inhalers without removing the cap or in inverted fashion, or they will use inhaler in a distant. So one should carry inhaler while attending asthma clinic every time so that the physician can recheck and correct the technique using some facts and myths about asthma. Asthma is not an infectious disease. It can occur at any age group. Every child born to the asthmatic parents may not develop asthma in future. Once an asthmatic is always an asthmatic. People will stop taking medication when there is no symptoms or less symptoms for certain duration. This is not correct. Following physician's advice and regular intake of medications may prevent future severe episodes. People have a stigma of carrying inhaler with them and usage of inhaler in the public places. One should carry inhaler anytime, anywhere, any place. One should avoid triggers, especially smoking, either directly or passively. Smoking causes further narrowing of airways and cause further exacerbations. Do not smoke and do not let the friends or family ones smoke. Regular usage of medications and regular follow-up will make the person lead happy and normal life. Thank you.